Guys, I've dealt with so much for the last 4 or 5 hours, and now the only reprieve I have is doing Anki cards. I saw a rat in my house. My girlfriend, she's on some. I'm not gonna say anything, but all I'm saying is the only thing that's gonna calm me down right now are these Anki cards. And we are going for what is considered a generational run of Anki cards. Uh, Generational, like generally, it's going to be generational. 1,000 Anki cards. It's 11 p.m. I don't care how long it takes me. 1,000 Anki cards are getting done. I'm so triggered, right? But so triggered. I'm so triggered. I'm so triggered. I'm actually so triggered. All I'm saying though, you just need to see this screen and you will witness a generational Anki run. Like generational. I'm talking I mean generational. I'm locked in right now. Okay. I'm locking in and I'm gonna talk through these cards like Alessandro, but what I'll do, let me unshare the screen. Okay. Let me share screen, entire screen, 2 screens. So you see, I'm done ChatGPT and me. It's over. We're no longer together. Me and ChatGPT are in beef. So I will be, for further use, it will be me and Gemini. Bruh, I don't think my computer is going to be able to bear sharing both screens, but I'm locked in right now. I've sent the stream link into the Discord. Feel free to join. Let's get just before opening that. So you have each lobby drains via lactiferous duct and around 15 to a lobby just before opening. Duct dilates into a what? Lactiferous ions, which then opens your nipples. Which duct systems, each lobule drains via lactiferous duct, around 15-20 lactic conversion via the nipple just before opening. Each ducts dilate into lactiferous, which then opens onto the nipple. You've got to know that there's lactiferous duct, which dilates 15 to 20 lactic, which just means the dilates in lactiferous ion, which opens onto the nipple. Nipple usually located at the level of T4, fourth intercostal space. T4, fourth. Usually located at the level of the fourth intercostal space. Nipple is usually located at the level of the fourth intercostal space. So we know that, it varies with age, gender, age, gender, and age, sex parity. Age, sex parity. So now we need to figure out what parity is. Parity, according to AMBOSS, is the number of pregnancies a woman has had that have gone past reached at least 20 weeks gestation. So nipple is usually fourth intercostal space, and depending on age, sex parity. Parity is how many pregnancies have reached around 20 weeks gestation. Let's check this. So areola contains what? The apical glands, sebaceous glands, may form into tubercles of Montgomery. Areola contains apical glands, sebaceous glands, tubercles of Montgomery. A few hair follicles. Supporting structures. The suspensory ligaments connects the dermis to the breast ducts, the dermis to the breast, the suspensory ligaments, the dermis to the breast, the pituitary flaps. Especially like connects to dermis or breast ducts to the posterior capsule. 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 Age, ligament atrophy, breast droops. Age, ligament atrophy, breast droops is ptosis. Drooper falling off of a body part. So then you have eye ptosis as well. Ptosis meiosis, which is Horner syndrome. Okay, so ptosis is just a general term. With age, ligament atrophy is a breast drooping. With age, ligament atrophy is breast droop suspension. Invasion of suspensory can make us skin dimpling or nipple. Invasion of suspensory can make us skin dimpling or nipple. Skin dimpling nipple. Invasion of breast invasion of suspension skin dimpling nipple attraction. Block is related to mastitis and abscess formation, like mastitis, not stuff of viruses. Use your breast cancer that advantage of the breast piece spelling that you may or may not be infection. Origin thrust supplementary arteries with origin. Master internal thoracic artery and intercostal artery. Axillary internal thoracic artery, intercostal arterial vessel, thorax, supplementary axillary internal thoracic artery. Axillary internal thoracic artery. The axillary internal thoracic arteries, intercostal arteries, internal thoracic arteries, intercostal arteries. Axillary internal thoracic artery, intercostal arteries, axillary internal thoracic artery, intercostal arteries. Axillary arteries are lateral thoracic and acromial thoracic. So axillary internal thoracic and intercostal. Lateral thoracic, acromial thoracic, lateral thoracic, promaxillary, lateral thoracic, acromial thoracic, lateral thoracic, acromial thoracic. Original from internal thoracic peripheral branches through first part of the intercostal, first part of the intercostal. Lateral thoracic, acromial thoracic, branches located. From axillary internal thoracic, intercostal actually has the thoracoacromial, acromial thoracic, lateral thoracic. So axillary artery, lateral thoracic, acromial thoracic. Then you have the internal thoracic artery, lateral thoracic from the actual internal thoracic is via a perfect margin. Drains to venous drains to corresponding veins, corresponding veins to corresponding veins, corresponding veins, axillary internal thoracic, internal axillary internal corresponding vacuum. Vertebral venous plexus is vertebral venous plexus is the side of breast column metastasis. Breast carcinoma metastasis or breast carcinoma metastasis to the vertebrae and spine occur to the vertebral venous plexuses, which are you have the axillary, internal thoracic, and intercostal veins, which all eventually drain into the vertebral venous plexus. Then you have axillary artery, internal thoracic artery, and axillary internal thoracic artery, and then the intercostal arteries, and then the axillary arteries, lateral thoracic, and the thoracoacromial thoracic, acromial thoracic, lateral thoracoacromial. So apparently it's the same thing. 4 to 6 intercostal space, 6 second to sixth intercostal, second to sixth intercostal nerves, anterior and lateral. Bro, do I respond or no? Do I respond? Respond. I'm locked in right now. Internal intercostal nerve, second to sixth anterior. So intercostal second to sixth, anterior and lateral thoracic branches, anterior and lateral cutaneous branches. Fourth intercostal. Okay, is the breast from the second to sixth intercostal spaces. Gemini, yes. Vertically from the second to sixth intercostal spaces. Oh, bro, Gemini is way better than GPT, bro. What have I been doing? Cervical vigor from the cervical plexus. Anterior innervation is internal intercostal nerve second to sixth anterior lateral branches. Then you have the, I know this, cervical plexus. I know it's from the cervical plexus and it's, oh, cervical, why didn't I do that? Supraclavicular nerves. What else is, I know it intermediate something else that's important. C3, C4, sensor next, posterior triangle. So yeah, supraclavicular nerve, posterior triangle, C3, C6, posterior shoulder, upper posterior shoulder, clavicle, anterior and lateral chest, upper posterior triangles. Okay. Intercostal nerve, second cervical plexus, C3, C5, and then it does anterior lateral branches. 75% sensory fiber, sympathetic fibers, essential for skin of breast and nipple areola. Skin of breast, essential for skin of breast and alveolar area. Nipple areola complex, skin of breast and nipple areola complex, skin of breast and nipple areola complex, skin of breast and nipple areola complex, sensory fibers, skin of breast and nipple areola complex. That's sensory innervation, and that is most likely the supraclavicular nerve from C3, C5, and then intercostal nerve. So I don't think either of these do sympathetic. Sympathetic. Oh no, I think each of them carries sympathetic innervation, blood vessels and smooth muscles of nipple. Via venous and lymphatic connections, especially spanned through Batson's plexus. So there's Batson's plexus in the prostate, and there's Batson's plexus also in breast cancer spread. Easy. Via venous and lymphatic connections, especially through Batson's plexus, venous and lymphatic, especially to span through Batson's plexus. Batson's plexus. Let me put this in Gemini and see what it says, because this is Batson's plexus seems pretty high yield. It's valvulus network. Yeah, I know that. Location of the plexus in the internal, inside the vertebral column, in the epidural space, and external surrounding vertebra. So it's inside, internal, and external. The epidural space around the vertebra connection connects the veins of the deep pelvis and thoracic. Okay, cancer is from the prostate, rectum, and breast. They can go to the brain, often bypassing the lung. Okay, this right here, prostate, rectum, and breast. That's pretty high yield, or easy. Venous and lymphatic connection, prostate, rectum, and breast. Bruh. Okay, I'm just gonna open up Gemini because my screen keeps crashing. So we'll open up Gemini instead. But you'll hear me go through the Anki cards via breast cancer spreads via, especially to span through breast via venous lymphatic connection. So venous and so is both hematogenous and lymphatic spread, especially Batson's plexus is possible. So issue with Surgery missing. Sensory loss or altered nipple. Sensory loss, altered nipple sensation. Sensory loss, altered nipple sensation. Venous structure, alcine venous structure. So what we need to know mainly from this card, lock this in. We need to arteriosclerosis the axillary, internal thoracic, and intercostal arteries. So then axillary is a lateral thoracic. Axillary internal thoracic is a separate branch. I'm pretty sure internal thoracic comes down this subclavian. Internal thoracic branch of subclavian. Correct me if I'm wrong. First part, there's three parts of the subclavian. One part is split by has the anterior scalene going over it. Then it goes into the axillary, and then the branch of the first part of the subclavian is the internal thoracic. Bifurcates at the 6th to 7th costal cartilages, superior epigastric. That is very important. We're anatomy with inferior epigastric branch of the externally musculophrenic. Okay, I know this one goes to the diaphragm as well. Pericardiophrenic, that's the pericardium, mediastinum diaphragm. That's that means the axis is an irregularly shaped pyramidal space open between the upper thoracic and legs. Between the upper thoracic arm, irregularly shaped pyramidal space, upper thoracic arm, and the anterior arm. Upper thoracic, there's the upper thoracic wall and the arm. So this entire thing is the axilla. And the axis is an irregularly shaped pyramidal. It's an irregularly shaped pyramidal space located between the upper thoracic and the arm. Neck and upper limb, intervascular neck and upper limb. Now, this part is the most important. Anterior wall, posterior wall, medial, and lateral wall. Lock that in. Anterior wall, I know that's pectoralis major. I know that's major. Pectoralis major, minor, subclavius. Pectoralis major, minor, and the subclavius should be like right around here, I'm pretty sure. Subclavius. Okay, let's figure out where. Show me an anatomical. The anatomical position of the subclavius. Guys, I'm permanently switching to Gemini. Me and GPT are done. Pec major, minor, clavicle and first rib. So yeah, I was right. It's about right here. Okay, nerve to the subclavius supplies it. C5, C6. And then C3, C4 was the other one, and that was supraclavicular. Okay, pectoralis major, minor, and pectoralis major, minor, subclavius. Pectoralis major, minor, subclavius. Pectoralis major, minor, subclavius. Anterior wall of the axilla is a pec major, minor, and the subclavius. It's posterior wall, suprascapularis, latissimus dorsi, and serratus anterior. Teres major. What was it? Subscapularis, latissimus dorsi, teres major. Subscapularis, posterior subscapularis, latissimus teres major. Subscapularis, latissimus dorsi, latissimus teres major. Posterior subscapularis. Pec major, minor, anterior. Medial wall. This is serratus anterior. Medial wall, serratus anterior. Medial wall, serratus anterior. Medial serratus. Coracobrachius, short head of bicep brachia. 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 Okay. So anterior pec major, minor, subclavius. Posterior wall, subscapularis teres minor, subscapularis teres minor, latissimus dorsi, medial wall, serratus anterior, lateral wall, coracobrachius, short head of bicep brachii, apex is distal border of first rib, middle third of clavicle. border first rib, middle, distal border first rib, middle third of clavicle, distal third, distal border first rib, so apex, distal border of first rib, middle third of clavicle, and one more thing. What is it? Superior border scap, distal border first rib, middle third of clavicle, superior border clavicle. That's your words, distal border first rib, middle third of clavicle, superior border clavicle. Look at soft vision. Or axillary artery and vein, ABIL. If lab, good acronym. Intercostal brachial nerve. Intercostal brachial nerve, intercostal brachial nerve, fat, lymph nodes, axillary artery and vein, brachial plexus. So the contours of the axilla, you do if lab as the acronym. Intercostal brachial nerves, fat, lymph nodes, axillary artery and nerve, axillary artery and vein, and brachial plexus. Intercostal brachial nerve, intercostal brachial nerve, intercostal brachial nerve, fat, lymph node. Big arteries, veins, lymphatic nerves, arteries, veins, lymphatic nerves. Why is that a card? Obviously, uh, between neck and upper limb, artery, axillary lymph nodes, and involvement, critical position, axillary. Life-threatening hemorrhage due to proximity to break up life-threatening hemorrhage due to proximity. Corrosion break up is vulnerable and surgery trauma more than surgery. Okay, this is a good image. Pec major and minor. Good. Serratus anterior and thoracic wall. Subscapularis teres major and latissimus dorsi. Intertubercular sulcus. I'm trying to remember. Short head and long headed bicep. So long head is infraglenoid. Long head is intertubercular groove. Is do the supraglenoid corporate. Supraglenoid corporate process, radial tuberosity. This is the longest supraglenoid corporate process, radial tuberosity, perseverance. It's an infraglenoid tubercle, olecranon process of the ulna, trusted olecranon process of the infraglenoid tubercle, long head, position of the humerus. So main one you need to know is where the long head attaches, which is the infraglenoid tubercle, olecranon infraglenoid tubercle, radial tuberosity, longest supraglenoid tubercle, corporate process. Radial tuberosity goes to the supraglenoid tubercle, tubular pec major minor. Bruh, he is opping me right now. Spheres engine thoracic wall. Tubular scapular series major scapular. I remember this. Lateral border. Intratrabecular sulcus. Superior lateral, superior lateral, superior lateral. Axilla, inferior, superior, inferior lateral. Superior medial, superior medial. Axillary tail. Oh, I remember I said axillary tail here today, because that's the main site of lymphatic metastasis spread in the breast. So that's superlateral, upper outer quadrant. And then somebody pointed down here? Well, I'm a bit confused. Watershed is a region where lymphatic drainage overlaps by between. Midline is along the midline. Breast watershed zone along the midline. Vertically, it's along the midline. Breast watershed zone vertically along the midline. The sternum vertically on the midline. The sternum horizontal at the level of the nipple at the fourth nipple. Remember specific nipple, fourth intercostal space. Along the midline septum, along the midline sternum. Vertical sternum. Above the nipple, primarily drains towards axillary above the axillary, then above the axillary, inferior axillary, inferior. Above axillary, villas, drives, and pressure on nodes. Easy tumors near water systems referred to multiple. Contralateral spread, possible drainage block. Just the main thing you need to know, watershed zone results in contralateral spread. It goes vertical sternum, fourth intercostal is nickel horizontal, and then above the nipple towards axillary, below is the inferior axillary peristernal. Easy, contralateral spread, especially drainage block. Locked in. NSAIDs, exert the following. Okay, that's easy. I know this for a fact. Analgesics, anti-inflammatory, antipyretic. Analgesic, anti-inflammatory, antipyretic. Antiplatelet? Easy. This will be on the exam for sure. Okay, lock this in. The one person watching right now, I don't know who's watching. Oh, it's the guy, the Discord bot, but anti-inflammatory analgesic, anti-inflammatory, anti-inflammatory, anti-platelet. Yeah, GPCR is reference back to GD2, GF2 alpha, GI2. I know PGE1 patents ductus arteriosus, I'm pretty sure. Yeah, it does. Participant inflammation, PGE2 and PGI2 play Visual dilation, increased access, increased access, potential effects, pretty kind of PG, DVD. VGG, baseline increased basket from visual dilation, increased access. So there's a pretty kind of potentially pain effects, pretty kind of certain pretty kind of PGG, pretty visual dilation, increased basket from not criminal. Visualization does a redness and heat, bit of redness and heat, bit of redness and heat. The basket permeability, there's edema. Studies nerve terminals, lower page. Basis for function things inhibit clocks enzyme. See if doesn't produce inflammation. PGF to alpha analyzed using glaucoma. Petra glaucoma. What's glaucoma again? There's something to do issue with the eye, right? Oh yeah, okay. Optic neuropathy is relevant specifically of errors, optic changes. Yeah, okay, I remember something with the eye. Alprostato. So I know appendicitis arteriosus you can use to alleviate a bit of a tetralogy of Fallot, and the tetralogy of Fallot is pulmonary stenosis overriding aorta, VSDs, and right ventricular hypertrophy. But the main treatment method should be surgery. And says inhibit what's COX-1 class 2, PGE2, COX-1 helps maintain PGE2 maintain gastric glycogen barrier and reduce gastric glycogen, reduce gastric acid, gastric glycogen barrier, and reduce gastric acid secretion. Takes ATP function, but it takes an PGI2. Yeah, COX-1. Produce back to wait, isn't it PGE2, PGI2? It's PGI2. Yeah, I messed up. Produce by activated pillage, promote the activated. Produce by activated pillage, promotes. Endothelial, PGI endothelial inhibits beta and causes visual damage. 12. So it's 12, 11, 9, 8, 10, 3 and 7, intrinsic value, and 10 to 10A, then 5, 5A, plus calcium, 2 to 2A. So to 12A, pre-calculum, calculum, 11, 11A. Takes it is formed in the platelets by just by aggregation. Aspirin irreversible inhibitors COX-1 irreversibly. So aspirin, remember, aspirin is an irreversible inhibitor of COX-1, inhibits TXA2 production, reduces evaporation. Aspirin irreversible. Aspirin irreversible. Uh, early Michigan prolonged labor. University of Psychology. Yeah, let me see how many cards I've done right now. Powers to Jacob, but with question, average is highly shifty guy. I'm right. I swear I'm right. I swear I'm right. It has to be PGE2. Yes! Lock that in, boys. Lock that in. High yield stuff right here. Rofecoxib? Rofecoxib, Rofecoxib, Cefcoxib. What the? I've never heard of Roxacoxib. Rofecoxib? Designed to reduce inflammation and pain while sparing coxswain, driving inflammation while sparing coxswain, selective coxswain. Rofecoxib removed from the market due to evidence that it increases MI and stroke. Rofecoxib is a selective COX-2 inhibitor that was removed from the market due to evidence that it increased MI and stroke. Highlighted safety concerns with selective COX-2 inhibitors. Okay, rofecoxib. Lock that in. Rofecoxib, selective COX-2 inhibitor that reduced inflammation and pain while sparing COX-1. Removed from market due to COX-2 decrease. So, antithrombotic is dollar, antithrombotic is dollar. Favors thrombosis, favors them. Lessons from Vioxx paracetamol, also called acetaminophen, analgesic antibiotic. Analgesic antibiotic. When I have PGE2 in the hypothalamus, reduces the hypothalamus, reduces the hypothalamus, PGE2 decreases fever. Does not block COX-1, COX-2, and peripheral does not. I know it blocks COX-3. Doesn't paracetamol block COX-3? Doesn't paracetamol block COX-3 in the brain? Bro, I know I spelled it wrong, but allow it. So it was a prominent hypothesis. So, okay, lock this in. Analgesic antipyretic, but not it's not anti-inflammatory. First line for pain fever, pain fever, pain fever in children, patients, GRS, children, patients, GRS, children, patients, GRS, asthma, nervous. Children, patient, children. Asthma, renal dysrhythmic. Asthma, renal dysrhythmic, violent. Children, patient, GRS, asthma, renal dysrhythmic, violent. Is well tolerated at therapeutic doses, lockdown, well tolerated therapeutic overdoses, hepatic necrosis, hepatic intestinal NAPQ1, accumulation, quotidian antibiotic, antidote, and acetylcysteine. Okay, easy. Analgesic, antipyretic, but not anti-inflammatory. Analgesic, antipyretic, but not anti-inflammatory. Bro, why is my Anki slower than the actual? Bro, safer sensors, but overdose. Locked in right now. There's 7 cards, and we'll take a break for like 2 minutes. I just need to. Person at therapeutic generally well tolerated. Group rounds. Mainly undergoes by phase 2 metabolism. Mainly because phase 2 45%. Mainly because phase 2 metabolism. Phase 2 group round is supplementation. Group round phase 2 group round supplementation 45%. Group round. Guys was highly toxic. It's not really mom. Not the family now. It's not the family now. So it's not the family. There, just Jonathan. Jonathan, Jonathan's very good. Editor is M's. Restores quotation directly after. You give activated charcoal when you for benzo overdose. I swear, was it benzo? Because I know you give like fluclomizinol, whatever. Uh, activated charcoal for benzo overdose and drug you counteract with benzomazole. Something like that. So I swear it's something like that. Flumazenol. All I'm saying though, activated charcoal and knowing its function as to how it does it might be on the exam. GI decontamination to reduce absorption of ingested drugs and GI. Okay, guys, I'm locked in right now. Just me on my lonely. Guys, the man, the myth, the legend, Alessandro was hopping on stream. It is generally not recommended for routine use in benzodiazepines. Items are used for GI chemicals. Uh, morphine, codeine, oxycontin, phenterol, tramadol, and methadone. Phenterol, tramadol, methadone. I swear, tramadol, it gets converted by CYP 2D6. Tramadol is a weak immune inhibitor that converts it into a strong immune inhibitor by CYP 2D6 or CYP 3A4. 2D6, I swear. Yeah, it's CYP 2D6. Okay. So, three. Okay. SSRIs inhibit CYP 2D6. I gotta get the call.
Yeah, so tramadol is a weak agonist of mu receptors, and it's converted, but it's a prodrug, and it's converted by CYP2D6 to O-desmethyltramadol. You're muted.
O-desmethyltramadol?
You don't need to know that.
Yeah, don't we just need to know that tramadol is a weak mu inhibitor that also blocks noradrenaline and adrenaline reuptake,
Yeah,
and that it
it
gets
can cause serotonin
in.
syndrome. Yeah.
Yeah, easy. Reinforces serotonin syndrome and okay, perfect. Morphine, codeine, oxycontin, fentanyl, tramadol, methadone,
You
methadone.
want methadone is a full agonist of mu receptors. That's the only thing that we know about it.
Okay, Morphine, codeine, oxycodone, codeine. Codeine is CYP2D6, right?
Codeine is morphine by CYP2D6. Yeah.
Okay, perfect. And SSRIs would inhibit CYP2D6?
We just know that inhibits serotonin uptake, but I don't think we know exactly what that's mediated by.
No, don't SSRIs, they inhibit CYP2D6, no?
I think so.
Because, like, let's say you're giving somebody codeine, but they're
Hmm.
on SSRIs, right?
Yep.
Because usually people mix SSRIs and codeines as recreational drug use.
Yep.
All right, perfect. CGMP. I don't see it. CGMP is nitric oxide, which is, we talked about that yesterday. CAMP is opioids, and CAMP is also, what is that? Glycogen. You know the glycogen GPCR?
Yeah, because that gives protein kinase, to use your Canadian language. Protein
The
kinase
right,
A.
the right language, the best
It's
language.
protein kinase A, bro. What is this nonsense?
Nah, it's kinase pronunciation, bro, in English. Let's get to it. I was pronouncing it right, bro. Google kinase, bro. It's not kinase, bro.
It's kinase.
It's kinase, bro.
No.
Just use the Google Translate. That Google Translate is giving the right pronunciation.
Yeah, right. Don't believe it for a millisecond.
Mu cat. Okay, what are the four opioid receptors?
Mu, kappa, delta. The fourth one.
Yeah, opioid
Uh,
receptor like one.
don't need to know that.
That's what I'm thinking because I got a previous card like this, right? And I'm like, it's only mu kappa delta, and then it's oral one as well. I'm like, what is oral one? We never learned that.
Well, that's a non-classical receptor that's also activated by endogenous opioids. So no,
Okay, easy. Mu kappa delta oral one.
in that order as well. No, actually, what is the order? Mu delta kappa is the order. Pardon me.
Is it mu delta kappa that's the order? I thought it was mu kappa delta that was the order.
I thought it was mu delta kappa. Hang on.
Order of strength of opioid binding on receptors. Bro, you need to switch over to Gemini. It's way better than GPT. GPT is actually a joke.
GPT works for me because I talk to it nicely.
Nah, bro.
It's mu delta kappa.
Mu delta kappa, not mu kappa delta, right?
It's mu delta kappa. That's the order.
Okay, easy.
You'll see. Type
Mu
it in. You'll
delta kappa. Yeah, no, I think you're right. It's mu delta kappa. I think you're right. Mu. Buddy, hey, buddy, I can. uh,
It was there. It was below the table. Key takeaways.
Kid is on spinning fire. Where?
Why is it talking about research?
I don't want research.
Let me find my Anki card actually. I don't think it matters. I don't think they're gonna ask that. Oh yeah, I have OR1 in my card as well, but I just never committed it to memory.
Bro, it's not even answering the question. Like, I forget this.
That's
Anesthesia,
fine.
respiratory.
Yeah, even like in Charlie's deck, it says mu is primary, but also delta and kappa. So I
Oh,
don't think
easy.
it's too important. Okay, I've done 2,500 cards. That's pretty good.
Easy energy.
I've got to do another week's worth of work. I have to do all the menstrual cycle to right now, actually.
Easy.
I think you're going down a rabbit hole that you don't really need to know. Just
Easy.
focus on just focus on answering the questions that are in the past exams. That has never been asked. This is like a honors level, question that you're looking at now in chemistry.
Kappa. So kappa energy, sedation, dysphoria specific to kappa, analgesia, euphoria, respiratory depression, and dependence is mu. Okay, easy.
A lesion at which spinal level will cause a loss of voluntary bladder control?
S2, S4. So anything above that will cause it.
Nice. And that's just because the external urethral sphincter is under somatic control.
Yeah, so S2, S4 is the external urethral sphincter that's under somatic control, which is from S2, S4 to pudendal.
Yeah.
And then S2, S4 is also parasympathetic innervation as well.
So it also messes with your internal. Okay, but the question explicitly asks for a loss of voluntary bladder control, so I would assume that it's just related to the pudendal nerve.
That it's if it's specific voluntary, that still makes sense because it's still both S2, S4. The only one that's different is T10 to L2, which is the sympathetic.
T11, T11L2.
T11 L2. And my card's is T10, but it should be, you're right, it's T11 L2.
In the lecture notes, it's T11.
Oh, easy.
Let me check that actually, because this was my favorite lecturer's. She did this PowerPoint.
Batty, bro.
Don't say that
Uh,
on stream.
no,
Yeah,
I mean it in a good way. Like, she's great.
T11L2 hypergastric, the true sine internal sphincter.
Yeah, easy. I don't know, in my cards it also says T10 to L2, but I think semantics, I should still give you the mark for T10.
Yeah, that's fair. All right, I'm gonna lock in and do the menstrual cycle,
Easy.
and then I'm also gonna try to squeeze in drug interactions and drugs in pregnancy tonight as well.
Easy.
Should be very doable. I'm just gonna mute myself. Actually, do you mind if I share screen?
Uh,
You're muted.
yeah, you should share a screen because my screen will keep crashing.
All right,
It'll
that's I'm
probably
fine
better
with
if
that.
you share.
Yeah, I'm just gonna mute myself for a bit, and I hope you don't mind, but I'm gonna turn my volume down so I can just get these cards done.
Yeah, no, easy. I'm doing the same.
If you just want something, just text me directly. I'll see the message, obviously.
Yeah, easy, same.
All right, thanks, bro.
Uh,
Oh wait, shh. Are you turning your volume down?
yeah,
Because I
depends on
can.
what you want to.
Well, I would like to talk to the stream, obviously, and because I know that Harry watches this.
Oh, yeah, okay, no, easy. I'll turn down my volume.
All right, cool, easy. Okay, so I am learning some brand new content. We are doing the menstrual cycle, so let's do these cards. This might be a bit too tricky to begin with, in all honesty. So let's not do these cards. Let's get stuck into the theory. Let me just fix these cards up. Sorry, just give me 1 second. I'm just trying to fix up these cards. Last time I did these cards was last semester, so they're a bit rubbish at the moment. Okay. Okay. The ovarian cycle. In the follicular phase, we have the recruitment of 10 androgen follicles. They all produce estrogen, but one becomes dominant, forming the graphin molecule. The others undergo atrasia. Okay. When estrogen reaches a threshold, feedback shifts from negative to positive on the pituitary. Then we have the FSH and LH surge for about 48 hours, and LH triggers follicular activity and rupture. I'm actually going to edit these cards slightly, just feed them the chat, make them a bit better. Here we go. All right. So, all recruited follicles produce estrogen. We already know this. One follicle becomes dominant for not completely understood reasons. The rest undergo atrasia. Okay. When circulating estradiol reaches a threshold, feedback at the HPO axis switches from negative to positive. We already know this. So we have the FSH LH surge for about 48 hours. And then LH is the primary trigger of rupture and ovulation. We already know that the ruptured dominant follicle becomes a corpus luteum, we have a shift from estrogen into progesterone dominance. Great. Without contraception, we know that the corpus luteum denigrates within 14 days, forming the corpus albicans. No, albin. Which what is it called? Albans, I think it is. Albicans. With pregnancy, HCG rescues and maintains it. We had the decline in progesterone and estrogen, removing the negative feedback. Allowing FSH and LH to rise and the cycle to restart. Okay. So 10 antral follicles are recruited at the start of the cycle. Not sure. They will respond to estrogen. They will produce estrogen. We need HCG in order to maintain the corpus albicans, otherwise it degenerates. Corpus luteum, otherwise it regenerates into the corpus albicans. We have a search of this and LH. Yep, that's fine. We know that. Yeah, we know that. We know that. LH and FSH search for about 48 hours. They produce estrogen. We have the switching feedback from negative to positive, the HPO axis. They have the shift from estrogen into progesterone dominance. Decline in estrogen, progesterone weakens. Negative feedback, allowing FSH and LH to begin. Again, LH is the primary trigger of the rupture and ovulation, I'm pretty sure. Okay. Decline in estrogen, progesterone removes negative feedback, allowing FSH and LH to rise, beginning this cycle again. Great. LH is the dominant hormone for rupture. LH is the primary trigger for ovulation and rupture. LH is the primary trigger of follicular rupture and ovulation. LH is the primary trigger for follicular rupture and ovulation. LH is the primary trigger for follicular rupture and ovulation. All right, I'm happy with that. Okay. Let's do... Is this like the same card? It's a similar card. Interesting. All right, let's get chat to make these cards. Okay, the initial follicular growth, primary to primary, is largely gonadotropin independent. Okay, so the initial follicular growth is primarily gonadotropin independent. We have rising FSH, and that stimulates follicle growth because follicle stimulating hormone, fair enough. FSH upregulates, I'm going to say upregulates FSH receptors in granuloma activity, aromatase activity, more estrogen. Developing follicles accumulate in antral fluid to form antral follicles. Okay. Increasing estradiol and actually, I'm going to check the things, the learning outcomes, because I feel like this is a bit much. I'm just not having a good thing right now. Objectives. Okay. I was on such like a flow earlier. What happened to my flow state? Menstrual cycle, amenorrhea, cellular events that make up the menstrual cycle, the hormonal change, identify the hormones released, how it's regulated with respect to the role of the follicles, the stress and neural influences, function of the FSH and LH surge, the rising levels, the variance of the menstrual cycle, conditions that may disturb the, yeah. Okay, fair enough. So increasing estradiol and inhibin B suppress FSH via negative feedback, driving selection. The selected follicle becomes dominant, being the Grafton follicle because it has a higher sensitivity. This is primarily gonadin independent, the initial growth. Upregulates that, producing more estrogen, becomes a Grafton follicle due to higher FSH density and sensitivity. Estradiol also upregulates LH receptors on theca and late granulose cells. Sustain high estradiol switches HP axis from negative to positive, triggering the LH surge. We already kind of said this. And the LH surge leads to completion of meiosis 1, and that goes to metaphase 2, raising fertilization. Okay, that's one card then. Yeah, easy. Cool. Estradiol, this is the theca cells, but what happens? It upregulates LH on theca cells. Estradiol also upregulates theca cells, producing androgen for aromatization. They take antral fluid to form antral follicles. Stimulates. I'm not having a fun time here. Stimulates follicle growth. They suppress FSH via negative feedback. Okay. Also stimulates theca cells, resulting in greater aromatization due to androgens. Operates LH receptors. Yeah, the menstrual. This is undoubtedly one of my weaknesses. Reduces FSH due to negative feedback, driving selection. Primes or interacts with theca cells, leading to the production of more androgens for aromatization. Rising FSH, well, it's just stimulates follicles, yeah. It leads to the production of more estrogen. That's fine. The primary follicular growth is gonadotropin independent. I finally got a card. Yes, we know that. Yes, we also know that. Comes the Grafton follicle due to high sensitivity. Stimulates the follicles. Leads to more estrogen stimulation. Leads to more estrogen production. They take an antral fluid to become secondary follicles. Leads to more production of estrogen. Interacts with Decker cells so they can produce more estrogen substrate for aromatization. For LH, okay. Reduce FSH via negative feedback, driving selection. Interacts with Decker cell, LH receptors on Decker cells, producing more androgen substrate for aromatization. Great. All right. That's okay. I know this is a weakness of mine, but it is what it is. Okay. So now we have the luteal phase. Okay. So luteinization is the ruptured follicle transformed into the corpus luteum under LH. Secretes high progesterone and inhibin A and moderate estrogen. Progesterone is going to drive endometrium changes into the secretory phase. Yep. So this is at the beginning then, yeah. Exerts negative feedback to suppress LH and FSH and prevents another LH surge by antagonizing estrogen's positive feedback. Inhibin is going to inhibit FSH, and then falling LH is going to lead to the corpus albicans. Great. So I can actually fix up these cards then. These can technically become 1, 2. There we go. Yeah, I can get rid of that and just merge those 2 cards together. Falling progesterone and estrogen remove negative feedback. So FSH rises and we have a new phase. Syncotroctobus produce HCG, which invades the endometrial lining and mimics LH to maintain the corpus luteum. And that sustains progesterone for the first trimester until cholesterol takeover. Okay, that's fine. Okay. So luteinization, we have the transformation of the ruptured follicle into the corpus luteus under LH. Great. The corpus luteus secretes progesterone and inhibin A high with a moderate level of estrogen. Great. Okay. This is going to drive the endometrium changes into the secretory phase. This is going to exert the negative feedback on LH and FSH. I'll remove the negative feedback, right? Remove the negative feedback on LH and FSH beginning a new cycle. No. Yeah, well, yeah, but there's an intermediate step. Okay. Falling progesterone and estrogen removes the negative feedback on LH and FSH, so FSH is able to rise and begin a new cycle. Antagonizes estrogen's positive feedback, resulting in an LH surge. The production of the corpus albicans. Inhibits estrogen positive feedback, preventing LH. The syncytrophoblast secretes HCG, which mimics LH for the corpus luteum. Antagonizes estrogen positive feedback on LH, preventing another surge. The ruptured follicle transforms into the corpus luteum through LH. Beta HCG is used to sustain it until the end of the first trimester, where the placenta takes over for progesterone. Prevents FSH secretion. High progesterone in the secretory. Falling estrogen to progesterone inhibits negative feedback, allowing FSH to rise once again and begin another cycle. Becomes the corpus abducens if there's no LH. Great. Inhibits estrogen's positive feedback on LH, preventing another surge. High progesterone and inhibit A, moderate estrogen. Inhibits estrogen's positive feedback, preventing another LH surge. Great. Okay, another card. Oh, so that's wrong then. Okay, so this is number 3. Okay, so this is number 2. Mm-hmm. We just kind of had this. So when estradiol cells remain above the threshold for 48 hours, feedback switches from negative to positive and simulates GnRH, LH, and a smaller FSH surge. When estradiol is above elevated levels for 48 hours, switches from negative to positive feedback and simulates GnRH, LH, and a moderate FSH surge. And the LH surge is going to lead to rupture of the graphene molecule and release of the. Is it rupture of the graphene molecule, or is it just the formation of the graphene molecule? It doesn't say that it ruptures in the other card. Yeah. Okay, so this is the intermediary. Yeah. Okay, fair enough. Why is it sinking? I didn't want it to sink. No. You know when you press the wrong thing? The computer's having a little annoying freak out. Am I back? Let me try sharing it again. All right, cool. We are back. All right, let's continue. So now I'm going to move on to the menstrual cycle itself. And we're just going to make some cards. So we're going to do the menstrual, the proliferative phase, and the secretory phase. I mean, I don't think that the menstrual cycle itself is hard to understand. I think like you can kind of like visualize what's happening. I personally have trouble with process like really chemical based processes like hormones and things like that, just because when there's a lot of different letters, I tend not to do well, unfortunately. But that's just me. So yeah. Anyway, like I tend to. Well, it's not like I have trouble. It's more like I just find it harder to actually physically sit down and try to understand it, because like like a random bunch of letters doesn't mean anything. Like when you look at like the creation of like foam cells, for example, we know that like we have scavenger proteins, and then the precursor to that is like VChem1 or IChem1. It's like, okay, well, it's just I know what it is, but like it doesn't really mean anything to me. So it's a bit hard to actually sit down and go, oh yeah, that makes sense. Like I have to put in some effort to genuinely get myself motivated sometimes for things like that. But that's just me, my ramblings at what, 12:46 a.m. All right, let's do the menstrual cycle. So, in the absence of pregnancy, the corpus luteum degenerates into the corpus albicans. We already know this. This causes a sharp decrease in estrogen and progesterone levels. We know this. Decreased progesterone increases prostaglandin and endothelin-1 production. These mediators cause vasoconstriction of spiral arteries and myometrial contractions, leading to endometrial ischemia. Ischemia results in degeneration and shedding of the stratum functionalis of the endometrium. Ooh. Blood, serous fluid, and necrotic endometrial tissue are discharged out of the vagina. The stratum basalis remains intact and regenerates the endometrium in the next cycle. The typical menstrual blood loss is 30 to 40 milliliters with prostaglandin mediated cramping. That's just what GPT is saying, at least. Okay, let's go again. Of the stratum functionalis, great. Sharp estrogen and progesterone levels, great. Increases prostaglandin and endothelin-1 levels, great. Blood, mucus, and necrotic endometrial tissue. Serous fluid is probably a better word to use there, that's right. Typical menstrual blood loss is about 30 to 40 milliliters with prostaglandin mediating cramping. Blood, serous fluid, and necrotic endometrial tissue is discharged via the vagina. These mediators include... I can't read. Oh my goodness. The viewer's probably picking up like some things about me. But anyway. The corpus luteum degenerates into the corpus albicans. Like, how many reading mistakes can I make on a single page? The stratum basalis remains intact and regenerates the endometrium in the next cycle. These mediators induce vasoconstriction of the spiral arteries and myometrial contractions. That's what I keep missing. Is 30 to 40 mils, often with prostaglandin-induced cramping. Vasoconstriction of spiral arteries, leading to endometrial ischemia and prostaglandin-induced myometrial contractions. Vasoconstriction of spiral arteries and myometrial contractions, leading to endometrial ischemia. Vasoconstriction of spiral arteries and myometrial contractions, leading to endometrial ischemia. Excellent. Pretty happy with that. Yeah, like I think an example was of what I was talking about earlier is like when I was trying to learn about like the insulin and glycogen receptor, it's just like it kind of makes sense. Like you have protein kinase A and protein kinase B respectively for glycogen and insulin receptors, but it's like the whole process is just like I had to wrap my head around and learn actually what it meant. But yeah, that's just me. Raising progesterone stimulates the regeneration of the stratum functionalis. Rising estrogen. Okay. Rising. Oh no, progesterone is the next one. Progesterone is the secretory phase. Pardon me, that's a bad mistake to make. Okay, rising estrogen from developing ovarian follicles stimulates regeneration of the endometrium. The stratum basalis gives rise to new stratum functionalis. Under estrogen influence, endometrial glands and spiral arteries elongate and proliferate, and we have progressive thickening of the endometrium that prepares for implantation. Okay. We have proliferation of the endometrium. No, that's not what was there. The endometrium thickens in preparation for implantation. Rising estrogen stimulates endometrial proliferation, regeneration of endometrium. We have the regeneration of spiral arteries and thickening. Spiral arteries elongate endometrial glands and spiral arteries. Okay. Rising estrogen from ovarian follicles stimulates regeneration of the endometrium. Under endometrial glands and spiral arteries proliferate and elongate. Yeah, not bad. Could be worse. I actually have to let me put numbers next to these because just for my work, number one, because they're in different areas at the moment in my what do you call it? In my notes. Number one, number two, number three. So we have the what happens at that is this the LH third? No, rising progesterone leads to a cessation of endometrial proliferation. Okay, so it's genuinely nothing to do with LH and FSH. LH and FSH has to do with the follicle itself. That's fine. Okay, not the actual endometrial lining. Progesterone stimulates endometrial glands to accumulate glycogen, glycoproteins, and glycolipids to support early implantation. It drives stromal and glandular differentiation to prepare the endometrium for implantation and increases basal body temperature during the luteal phase. Okay. Well, it drives glandular differentiation to prepare the endometrial for implantation. Basal temperature increases. Progesterone leads to cessation of, well, there's endometrial cessation of proliferation. They pull together glucose, glycolipids, the glycogen. Progesterone stimulates endothelial glands endometrial, my goodness. Progesterone stimulates endometrial glands with glycogen, glycoproteins, glycolipids to prepare for early implantation. Progesterone stimulates endometrial glands to accumulate glycogen, glycolipids, and glycoproteins to prepare for early implantation. All right, I'm right with that. Okay. So now we are up to oral contraception. So it contains both estrogen and progesterone. It's 3 weeks with 1 week placebo. 99.7% perfect use, 99.1% typical, 91% typical. Okay. Estrogen inhibits the mid-cycle LH surge that thickens cervical mucus and makes the endometrium less suitable for implantation. It causes withdrawal bleeding, but is not true menstruation. It's very easy to use. Helps manage heavy menstrual bleeding, improves acne, reduces risk of cancer and cysts. It's a higher failure rate with typical. It can cause arterial disease, not suitable for breastfeeding mothers, and interacts with some medications. Estrogen inhibits LH surge by suppressing gonadotropin secretion. That's a typo. Progesterone inhibits LH surge in ovulation, thickening cervical mucus, impairing tubal motility, and just reducing the suitability of the endometrium. It causes withdrawal bleeding, which is not true menstruation. Nice, 9.7, 91. Not suitable for breastfeeding mothers. It can cause DVT and arterial disease and interacts with some medications such as epilepsy, anti-epileptics, VTE, not DVT. I've already kind of said this one. Mid-cycle LH surge, thickens cervical mucus, not true menstruation. Helps manage acne, reduces the risk of ovarian cancer, safe, reversible. Okay, now let's do the progesterone only pill. Contains only progesterone. All 28 tablets contain the same dose. Again, same thing, thickens cervical mucus to inhibit sperm migration, suppresses ovulation, slows egg transport, and thins endometrium. Few contraindications, suitable women who cannot take the combined oral contraceptive pill, and is safe during breastfeeding, does not protect against STIs, and is highly dependent on when you actually take the pill. Who cannot take estrogen, safe during breastfeeding, highly dependent on time taking the pill, can cause, does not prevent STIs, can cause uncontrollable bleeding patterns, thickens cervical mucus, suppresses ovulation in about 50-60% of cases, slows the egg through the fallopian tube, and then thins the endometrium. Cool. All right, a couple more cards. Granulosa cells are stimulated by FSH. They express aromatase, which we know converts androgens into estrogens, and they're located in the inner layer of the follicle. Theca cells are stimulated by LH. They produce androstenedione. Oh gosh, I'm gonna androstenedione, and they're located in the outer layer. FSH express androgens, aromatase, which converts androgens into estrogens, located on the inner layer of the follicle. And then we have, stimulated by LH, produce androstenedione, an androgen precursor, located on the outer layer of the granulosa cells. And I think we're happy with that. Yes. Okay. So all that's left is to try to figure out this. All right, so we got this. So this is the primary follicle. So that's the egg, that's the zona pellucea, and that's the corona route. Oh, never mind. That's not right in the slightest.
Bro, my Anki crashed my fucking computer again, bro.
That's so good, man.
Log back in, bro. Fuck.
Okay. So the oocyte, the follicular cell, the stromal cell forming the zona pellucea. Actually, I'm gonna skip these cards just because I know that we do a bit more when we get to embryo development, and that will probably be more helpful for embryo development. Yes, yeah, I probably will. Because I also do histology of the female GIT. Yes. Yeah, okay. I'm gonna actually move antrum. When do we look at the antrum? Is there a card that has antrum? Yeah, okay. So there's a repeat of these cards later on. So I'm just gonna personally delete these now. I'm gonna move on to this last batch for the menstrual cycle. Okay. So I gotta figure out where I am. So okay. So we have the hypothalamus, which secretes GnRH, and then we have the anterior pituitary gland that secretes FH and FSH and LH. LH we know goes to the corpus luteum, and that's to produce progesterone, and that lasts about 1 trimester before the placenta kicks in. Then we also have LH going to Theca cells. Is there a way that I can memorize this? Well, they both have H, so I can't do letter association. Theca cells have the angiotensin, and granulosa have aromatase. Androtenedione. I'm just going to go S for FSH. And then aromatase. And then Theca. Okay, fair enough. And that's going to inhibit my pituitary gland. That's actually going to excite. No, hang on. Yes. So Theca cells cause a inhibition. Granulosa excites. Okay, fair enough. Theca cells get LH. They what do you call it? The androtenedione, however you pronounce it, and that causes an excitatory. Oh, they synthesize androgens. Hang on. What was the? Sorry, I'm getting mixed up. I can't even pronounce it on a good day, so I'm not even going to claim. All right, help me out here. Granulosa. Theca produce that, an androgen precursor, and that's used to. And then that's given to granulosa cells, which converts that into estrogens via aromatase. Oh, that actually makes sense. Okay, I'm just gonna still understand why there's so many cards here. Maybe I can adjust that previous card slightly. Yeah, I think this is a bit too much. I do like it, but I just don't need these ones. That's right, let's give it a shot. Okay. GnRH. This is both LH, Theca cells and corpus luteum. This is FSH. Corpus luteum produces progesterone. We kind of said this one earlier. Granulosa cells use androgen, use adenin, from, what do you call it? What's the word? What's the name of the cell? Granulosa cell. No, this is a granulosa cell. Theca cells, yes. Theca cells to produce estrogen using androgens, using aromatase, pardon me. Do they secrete estrogen? Yeah, that's fine. Corpus luteum. Yes, we already kind of know this one. I'm not going to care about that card. Estrogen created from low concentration is negative feedback, high concentration is positive feedback. Okay, get rid of that. I don't need that. This is the excitatory. Inhibin has negative feedback. Okay, so I represents negative in feedback. So corpus luteum produces progesterone, inhibin, and estrogen. Yeah, we said that. It's high amounts of progesterone and inhibin A and low to moderate amounts of estrogen. So then granulosa cells secrete inhibin and estrogen, but Thecus cells then don't secrete anything. They just make androgens that granulosa cells use to create estrogen from aromatase. Okay, that makes sense. That makes a lot of sense. And the corpus luteum just makes progesterone. Yeah, I'm pretty happy with that. And that's just inhibin. Cool. That wasn't too bad, actually. I kind of just had to kind of wrap my head around it. Not too bad. Okay, let's move on to drug interactions. Do I have to do any pharmacology? 28 cards for pharm. All right, let's quickly go through these. Oh, I'm getting mixed up between RTKs, kinase linked receptors. Is this estrogen, vitamin D? Okay, cool. Yeah, good. Whatever it is, it's diazepam. Preventing dimerization of HER2, leading to reduced proliferation. It is 2, 3, and 5. That's muscle relaxation. Bone pain, myalgia. No, that's the other one. Less than 6 millimeters. Yeah. Hypnotic effects develops quickly. GI protein. Yeah, causes bradycardia. Aldosterone. They have a high. What do you call it? Oh, yeah, that's the definition. Hepatotoxicity. Fever chills. No, I always get these mixed up. It's not good. Barbiturates only increased duration. They have a high it's not safety profile. I keep getting these cards mixed up. Interesting. Allopurinol and deoxypurinol. Androgenic alpha beta. Vomiting, no. Vomiting, nausea. 1 and 5 is related to interrogate amnesia. Okay, so aromatase is because it's in postmenopausal women, so I'm gonna associate it with that. Okay. All right, I have 15 minutes left. Then I have to go to bed. So we have to make some new cards. Okay, I have about 5 minutes left, so let's quite quickly try to get through as many cards as we can. So firstly, so alcohol crosses the placenta and fetal levels are approximately equal to the maternal, although fetal metabolism is limited. No amount is safe for any trimester. Advise complete abstinence. I don't know why the cards are like this though. Why are the cards like this? Is it like that for everything? That's really odd. It's just like that for alcohol for some reason. Okay, I just fixed it. Give me a sec. Cool. Bingo. There we go. So alcohol crosses the placenta. Fetal levels are approximate to maternal levels. But it's limited, so we completely advise against any using complete abstinence. Characteristic facial abnormalities. The mid-face hyperplasia. Growth restriction. Cognitive deficits, learning difficulties, and congenital heart disease. And this is osteoporosis, vaginal dryness. Cool. Okay. Tobacco use, miscarriage, ectopic pregnancy, placental abruption, preeclampsia. So miscarriage, ectopic pregnancy, prematurity and low birth weight, SIDS, cleft palate, respiratory, advised cessation at any gestation. If needed, nicotine replacement therapy is safer than smoking. Miscarriages, ectopic pregnancy. Oh no, that's the other one. No, that's the top one. Oh, this is the fetal risks. Prematurity and low birth weight, cleft palate, other congenital abnormalities. This was prematurity and low birth weight, increased risk of SIDS. Nicotine patches are safer than smoking. Respiratory issues and neurodevelopmental problems. Miscarriage, ectopic pregnancy, preeclampsia. Okay. I think I'm gonna tap out here, in all honesty. I got 1, 2, 3, 4, 5, 6, 7, 8. 8 more batches to do. I could probably get a bunch of it done. Yeah, that's pretty fair. Okay. Thanks for playing. I'm gonna go to bed because it's like 1:30 and I got work in the morning. So yeah. Actually, how many cards did we finish? We ended up with 2,600. Almost 2,700. Not bad. Left some cards undone, but we can always do that tomorrow. I have 352 cards to do tomorrow, which isn't too bad actually. I probably realistically could get that done in like an hour and a half. Well, plus the 150 cards that I didn't do today. So probably 2 hours of revision, and then we just keep plodding along. But yeah, thank you so much. I'm just going to message Shahab. Going to bed. Good night. I am going to bed because I got work in the morning.
Oh shit, my bad. Yeah, you should probably go to sleep.
That's so good. I got a 6-hour tutoring shift tomorrow morning.
Damn, that's cooked, bro.
Well, it is, but you know, it's a good job. I get to help kids that they're sitting the HSC now, which is like the final exams. So it's a bit stressful for them, but I get to help them out, which is pretty rewarding. And we've all been there once.
That's valid. I'm gonna be on locked in.
Yeah, I got 9 batches of cards left, and then I'm actually done forever. So I'll probably, as I said, I'll probably realistically be done on Sunday. I was literally just doing the drugs in pregnancy.
Mm-hmm.
So I know that you asked me questions about that on today, as well as like micturition, because I know again you asked me questions about that today. So I think I got all my bases covered.
Easy. I'm almost like for today. I have like 683 cards.
Mm-hmm.
I'm almost done, so I'm chilling.
Yeah, but like it's pretty good, right? Because like tomorrow, today really, I only have 500 cards due for the whole day.
Damn, no, I still got
And
7,600.
that's just because I absolutely just locked in and just like did all like 3 weeks worth of I did, because you know how it has like your next 30 days.
Yeah,
I did my entire 30 days in 1 week.
damn. That's a lot,
But
bro.
yeah, thanks for playing. Good as always hanging out with you, Shahab. This is my
Of
boy.
course,
Yeah, this is my boy.
of course. Always locked in. Always locked in. Ain't letting no females distract me right now. I'm locked in on the game. I'll be on until like 4 a.m. I'm just gonna finish off week 16 and shower,
Yeah.
and then I'll come back. I want to go eat
Weeks.
food, but there's a rat downstairs right now, and I don't want to go and see the rat.
Week 16 is pretty straightforward.
But yeah, it's pretty straightforward. I'm not gonna lie. It's just breast cancer. Not bad.
What
I think
is week 16? Anatomy of the breast, breast cancer, function of breast,
opioids.
neoplasia, opioids, NSAIDs, and then
Yeah,
technically menopause begins. You start looking at that.
yeah, of
Easy. All right, thanks, Shahab. I'm gonna go to bed. Good night.
course. I'm locked in. I'll be on. I'm just gonna break after week 16, but I'll be on.
Easy. And then on Sunday night, you and I, we're gonna go back and forth questions on stream.
Easy done.
All right, let's do it. See you, man.
Bigger. Hey guys, you're stuck with me right now. Bro, I've been like pulling out my hair like randomly, but I'm locked in. I'll be on for a while, and we're pushing through this night. I'm telling you right now, 682 cards. I've almost done 1,000 cards. I think I've studied, about the same time. I'm at 3.95. Okay, I'm just putting up my screen here so you can see it. But my screen sometimes automatically like throws off. But yeah, easy. And these are my numbers right now that I'm locked in. Just delay overdo this because I'm not touching this right now. Okay, easy. Okay, past systemic therapies are non-specific cytotoxic chemotherapies, non-specific cytotoxic chemotherapies, non-specific cytotoxic chemotherapies, and you have target therapies, hormonal therapies, non-specific cytotoxic target therapies, hormonal therapies, immunotherapies, non-specific systemic therapies, non-specific cytotoxic chemotherapy, and yet the targeted therapy or hormonal therapy. Targeted therapy, which is HER2, hormonal, which is tamoxifen and tamoxifen. Oh, you're as usual. I get disconnected, bruh. I want to share my screen. This is so annoying, man. I don't know why it keeps crashing. Dude, what is Gus, what are you saying right now, bro? What do you mean, what is my layout? For Anki? Bro, I'm telling you, this is the most elite Anki layout. Non-specific subjects, non-specific subjects, systemic theory. Because I customized it to be blue, bro. That's why it's blue. Non-specific subjects, non-specific subjects, chemotherapy, systemic therapies, evolution, cancer, non-specific subjects, hormonal, immune, and what is that? Specific, targeted therapies, hormonal therapies, immunotherapy. Bro, my guy's a hater. I'm telling you right now. I can link you this plugin if you want to customize your Anki as well. Well, what is IPDP1, bro? IBDP1? Wait, what is that? IBDP1? I'm trying to Google this right now. International Bachelorette? Crazy. Oh. But what are you doing in International Bachelorette? Is that high school? Damn, bro, you're in my prayers, bro. I remember that high school struggle. Bro, I'm telling you right now, high school, that shit. Oh, oops, but high school is a joke, bro. Enjoy your life. What do you want to do? Like, what's your plans after high school? College board students are lucky as hell. They give you grades for free. But which country are you in, Gus? Bro, man, I would say not to do medicine but I'd be a hypocrite. All three of us, well, any face you see on this channel are med students in their first year. If I was to give you some, oh, true. Thank you for the click. Thank you for the view. Really appreciate it. But if you want some advice, man, I'm telling you right now, the best thing for you to do. Do you want to do MBBS or MD? I'd recommend you do an MD and you take a couple of years off before going into med. Like go and explore and figure life out, because when you're in med, you don't get the opportunity to do that. Inhibitors, trastuzumab. HER2 inhibitors, trastuzumab. Targeted therapy is HER2 booster, trastuzumab. Inhibitor of trastuzumab. That's monoclonal antibody. Herceptin. Or PB. Using the treatment ERPB2 positive breast cancer, breast and gastric cancer, cardiotoxicity, dilated cardiomyopathy. I don't need to know that. HER2 inhibitor, trastuzumab. HER2 inhibitors, example trastuzumab. HER2 inhibitors, example trastuzumab. Examples choice 2 SIMAD, HER2 different examples choice SIMAD. Targeted therapy, hormone therapy, you have tamoxifen or aromatase inhibitors. Tamoxifen is converted endoxifen by what? Is it CYP? Which CYP converts tamoxifen to endoxifen? I know this. Is it CYP3A4 or CYP2D6? Tamoxifen to endoxifen. CYP. 3A4. 2D6. Okay, I was right. It's 2D6. Herceptin, immunotherapy, checkpoint inhibitor, melanoma checkpoint inhibitor. Molecular profiling enables you don't do HER2. Okay, I am almost done. Okay, guys, I'm done. I think week 16. I'm going to move on to doing week 15. Oh, I'm more than halfway done? Damn. Bro, why does my Anki keep crashing? Okay, I have to. So I'm doing a new week now. Now, I'm going to take a bit of a break and I'll be back shortly. But now I have about. Oh, you're studying in India right now? So then that means you'd go into an MBBS, no? Bro, why would your parents cook you and move you from the US to India? That's so crazy. That's why you're watching an Anki video, eh? Bro, don't go to Canada, man. I'm telling you right now. I'm from Canada, bro. Don't go to Canada. Go to Singapore. Trust me when I say this. Canada is cooked. Like, I left Canada, come to Australia to do medicine because Canada is done. It's finished. It's like the worst version of Australia because Australia, the weather is nice. Oh, fair enough, fair enough. But yeah, like I'm saying, bro, the weather's nice. If you're born in the US, do med school in the US. Bro, trust me, bro. A lot of things wrong with Canada. I'd never go to that country, bro. The weather's terrible. Cost of living is trash. The people aren't as nice as they used to be because they have issues with the current levels of immigration. I was born in Canada, and let me just tell you, like Canada from pre-COVID to post-COVID is like a completely different universe. Like it's changed so much. Like I'm from like Mississauga, which is where the Pearson Airport is, and it's right by Toronto. Like Toronto, eh, always construction, always construction. Like construction projects happen since like the day I was born, like even prior to my birth, bro, the construction projects are still running. That country, I actually feel bad for anybody that stays in Canada. Like genuinely, I feel so bad. Like Canada is not the place to be, bro. All I'm telling you, like I'm giving you advice as a brother, bro. Don't go to that country. Like genuinely, Canada will F you. Go to the US. Like if you're born in the US, which state were you born in the US? Because I did the US app for med school. Yeah, this next is alkylating agents. All right, that was on the midterm, so they're not going to ask about methotrexate and breast cancer. Oh no, you got cooked, bro. I'm sorry to hear that, man. They actually cooked you, bro. Do Singapore then. I highly recommend Singapore, bro. And right now, Canada, more easy. No, I highly recommend Singapore, bro. Even Canadian med schools are after, like generally they're after. Letrozole, CYP19A1 inhibitors. BPH again, cancer-related genes, carcinogenesis, checkpoints. All right, checkpoints is something I'm not. Red blood cell, full blood cell count. All right, easy dysplasia, oncogene, formation of DNTPs. Yeah, that's pretty high yield. I would say no, it's not. Uh, yeah, no, man, that's understandable. I was talking to somebody recently who taught in Indian schools, and they said that it's like it's incredibly difficult there compared to like American schools. Oh no, bro, what? No, you couldn't beg for no grades in Canada, bro. They'd cook you. Like, what do you mean you could beg for grades, bro? That's crazy. Yeah, anyways, right, I'm done looking at what I need to look at. So I gotta call my. I'm going on break, so I gotta call my parents. So yeah, like I was saying, I gotta call my parents because they're awake right now in Canada, and uh, what the plan is on stream. I'm finishing week 15. Yeah, take care, Gus. It was a pleasure talking to you. But yeah, I'm gonna finish week 15 tonight. So that's about 542 cards. Then I'm gonna do a bit of week 14 and try to get it down to exactly 7,000 cards. So then if I do 7,000 divided by 1,500, I can finish this deck in about 5 days. Okay, my goal is to finish this deck before Halloween because I gotta go somewhere with my girlfriend on Halloween. Yeah, bro, man. Word of advice: don't date in med school. But yeah, okay, locked in. I'll do like maybe 3 or 4 more cards. Main causes of cancer, genetic mutation caused by DNA damage, and genetic particular being on solid uncontrolled cell growth. Right. You know what? I'm gonna go because my earphones are dead, and I'm just gonna keep hearing the hit marker sound until I. And here, predisposition recommend back to TV. Recommend increased risk of breast and ovarian cancer. Recommend. So, leave for many syndrome. What is that? Do we need to know that? Sarcoma, breast carcinoma, leukemia, Adrenocortical, so that's an adrenal gland, the cortex, carcinoma that can grow at an early age. T53, yeah, okay. T53, T50 may be from many syndrome, from many syndrome. So the strongest preventable carcinogen is smoking. Saying that to a smoker though. Strongest preventable carcinogen, strongest preventable carcinogen, lung, oral, and bladder. So it causes lung, oral, and bladder cancers. UV radiation, skin cancers, melanoma, SCC, BCC. The SEC. Where's the SEC? Basal cell carcinoma, squamous cell carcinoma, squamous cell, basal cell epithelial cells rise from basal epithelial cells. Skin cancer. Lung, head, neck, skin, esophagus is where you find squamous cell carcinoma, skin cancer, asbestos, aflatoxin, benzene, asbestos, aflatoxin, benzene, asbestos, aflatoxin, benzene, aflatoxin. HPV, EBV, HPV, HPV, asbestos, mesothelioma, aflatoxin, hepatocellular carcinoma, benzene, benzene, hepatocellular carcinoma, aflatoxin. What is that? Asbestos, mesothelioma. HPV to cervical and oropharyngeal cancer. So HPV, cervical oropharyngeal cancer, oral, cervical and oropharyngeal cancer, or HPV cervical. My shorty's got so the cervical oropharyngeal. So HPV cervical oropharyngeal, cervical oropharyngeal capsule, and cervical and oropharyngeal cancers, HPV. Burkitt lymphoma, nasopharyngeal carcinoma. Burkitt lymphoma, nasopharyngeal carcinoma. Burkitt lymphoma, nasopharyngeal carcinoma. The EBV, Burkitt lymphoma, nasopharyngeal carcinoma. EBV, Burkitt lymphoma, nasopharyngeal carcinoma. Then HPV, cervical oropharyngeal. Burkitt lymphoma, nasopharyngeal carcinoma is EBV. EBV, HPV, cervical oropharyngeal. Legislative carcinoma, VT, gastric adenocarcinoma, gastric adenocarcinoma, gastric adenocarcinoma, mucus associated lymph tissue lymphoma. Chronic inflammation promotes DNA damage, cell damage, DNA damage, cell turnover, Yeah, I don't even know what I'm doing. I should be on break right now. Post-transplant HIV, image of HIV/AIDS, pictures of sarcoma, the pussy sarcoma. Okay. Guys, 7,650 cards I'll get it down to, and I'm happy. Where is it? Right here. Let me share my screen to you guys. So what I want to do, get that down to 7,650, then go on break. Then break, I mean I gotta call my parents, shower and stuff. But 7 more cards. I know I said I got a break like 15 minutes ago, but F it. Agent that directly promotes cancer affiliates with agent directly promotes physical promotion. Agent that directly promotes and facilitates progression. Bro, see, this is the problem, bro. Like, my StreamYard is cooked. I don't think it's StreamYard. I think it's my Anki. Like that, my Anki's got thick, bro. I was sure Gemini, but the thing is now my Gemini's crashed. Agent that directly promotes cancer surfaces, promotes cancer physical progression, carcinogenesis, multiple step process driven by what? Gene mutation, cellular changes, multiple steps driven by gene mutation, cellular changes, multiple steps driven by gene mutation, cellular changes, carcinogen. So, key stages are initiation, promotion, progression. Key stages of carcinogenesis, or initiation, promotion, progression. Initiation, promotion, progression. Initiation, promotion, progression. Initiation, irreversible, rapid process, permanent DNA change in cells by carcinogens. Irreversible, rapid process, permanent DNA change in target cells by carcinogen. Initiation, irreversible, rapid process, permanent DNA change in target cells by carcinogen. Reversible, rapid process, initiation, reversible process. Promotion, it's a reversible phase. Promotion is a reversible phase. Tissue and cellular changes before the first time tissue. The autonomous cancer cell emergence. So first autonomous cancer cell emergence before the reversible tissue cellular changes before first autonomous cancer emergence. First autonomous cancer emergence. Tissue and cellular changes. Emergence image proliferation initiates but do not track again. Promoters initiate presumably. Proliferation of cancer cells is one malignant version using. Evolution cancer is one inclusion. Guys, I keep saying I'm going on break, but I'm not going on break. I don't know why. They actually need to go on break. Okay, the 4 hours 0.717 was how long Alessandro was on Anki for. Bro, just want to have a heart-to-heart talk with you guys about relationships, man. If you're planning to go into medicine, do not make the mistake I did. I love the girl. She's a great girl. Just hard to balance, bro. Especially during exams. I think I cooked myself. I've barely been able to do anything for YouTube and photography as well. Gotta start upping that during the break. But big things coming soon, guys. All I'm saying, next year I'm gonna be even more locked in because I don't have the excuse of moving to a new country. But you're gonna see a crazy amount of streams next year on both channels, like this night shift channel, Drew mine, and basically Alessandro's channel as well. Yeah, basically us three's channel, and then you'll see some stuff with what do you call it on my channel too. But there'll be a lot of videos coming out, a lot of shorts as well. Follow the Instagram too. Do some banger videos on the IG. But yeah, I'll be back shortly. my genuine apologies. I was in the washroom showering and I went to go call my parents. Now, the only thing I gotta do left is these cards and I'm good. And I'm just gonna pray and sleep. I'm gonna do it. I'm gonna aim for like 4:35 a.m. So we'll probably go on for like another 2 hours. Yeah, easy Osaka. I will speak it out and I'll try to switch to sharing my Anki card screen. Let me whip this. Okay. Very easy Osaka. Inhibition of protein progression to mitosis, repair time is short, so less opportunity for radiation. Most of ionizing radiation is due to an M phase. Most of the ionizing radiation. Those are focused on division rather than repair. Cells are mostly ionizing G2 and M, G2 and nitrogen ionizing radiation. Cells are focused on division rather than repair. The methotrexate is a polyantagonist committed dihydrofolate polyantagonist, which is committed dihydrofolate reductase. Committed dihydrofolate reductase, I know this. Previous conversion of DGF, tetrahydrofolic acid, dihydrofolate reductase, tetrahydrofolate. Decreased pyrimidine synthesis of DMP, decreased pyrimidine in DMP, DDD. Pyrimidine in DMP, decreased pyrimidine, DHF, decreased pyrimidine in DMP, DDD. BTTP, decreased pyrimidine. Blocks Stevenson replication. Blocks Stevenson replication. Acts during acid is also like Blocks Stevenson replication. Active. Purine antagonist, anti-mercaptan, purine anti-metabolite, mercaptan, purine anti-metabolite. So the chemotherapy agents inhibit DNA synthesis, nucleotides, and methotrexate mercaptan. It's activated by HGPRT, thionosinic acid. Times of purine. Activate HGPRT, the TIMP inhibits enzymes. Purine biosynthesis. TIP inhibits purine biosynthesis. TIP. Okay, bro, this is getting very annoying. So I'm just gonna share my screen with I'll share my Gemini window. Activated by HGPRT TIP inhibits enzyme of purine biosynthesis. Because purine synthesis DNR is because purine synthesis DNR. Activate HE purity thing, TIMP, TIMP, essential PR bytes. Decrease appearance of the DNR appearance to the DNR RS HE purity, TIMP. The other one is mercaptopurine. Mercaptopurine is compared to HE dodge for reductors. Side effects: myelosuppressing mucositis, myelosuppressing mucositis, and hepatomyelosuppressing mucositis, hepatotoxicity. 42 more cards and I'm calling it a night. I can't go, like, I'm literally about to pass out. And I'm pretty close to passing out right now. It's crazy. I have 42 cards. I can't give up. Man of my word. Yeah, at least get down to 1,000. Targeted therapy, surgery, negative, PRP1, HER2, PRP1, PRP1, HER2, negative, PRP1. Guys, wallahi, I'm struggling to stay awake right now. It's crazy. And consider this, I've been up since I think 8 a.m. and now it's like 3:14 a.m. So in all honesty, guys, I might just end the stream. I have to pray as well. Oh. This stream is over. I can't keep going. I'm gonna go to bed and do the rest of these 33 Anki cards. Yeah. Thanks you for tuning in. Have a great night. Take care.